As we age, our bodies undergo numerous changes, some subtle and others more pronounced. Among these changes, skin issues like itching can often be dismissed as mere annoyances or attributed to aging itself. However, persistent or unusual itching in specific areas can be a critical warning sign of serious underlying health conditions, including cancer. For elderly individuals, recognizing these signs early can be life-saving. Doctors are increasingly emphasizing the importance of paying attention to these symptoms, as they may provide crucial clues to diagnosing serious illnesses like cancer. Below, we explore 6 itchy warning signs in the elderly that should not be ignored, delving into their potential links to cancer and why prompt medical attention is essential. 1. Persistent itching in the lymph node. One of the most concerning itchy spots in the elderly is around the lymph nodes, particularly in the neck, armpits, or groin. Lymph nodes are part of the body's immune system, and persistent itching in these areas can signal lymphoma, a type of cancer that affects the lymphatic system. Hodgkin's and non-Hodgkin's lymphoma, for instance, often present with swollen lymph nodes accompanied by intense itching, especially at night. This itching, known as pruritus, may not be relieved by scratching and can spread across the body. Doctors note that this symptom is particularly alarming when paired with other signs such as unexplained weight loss, night sweats, or fatigue. For elderly individuals who may already experience skin dryness or sensitivity, distinguishing between benign itching and lymphoma-related pruritus can be challenging. If the itching persists for more than a few weeks or is accompanied by palpable lymph node swelling, a biopsy or imaging tests like a CT scan may be recommended to rule out malignancy. 2. Itchy skin on the chest or abdomen. Itchy skin on the chest or abdomen can sometimes be a red flag for cancers affecting internal organs, such as liver cancer or pancreatic cancer. These cancers can cause a buildup of bile salts in the skin, leading to intense itching that is often worse at night. In the case of pancreatic cancer, the itching may be accompanied by jaundice, yellowing of the skin or eyes, dark urine or light-colored stools, as the tumor obstructs bile ducts. For elderly patients, this type of itching may initially be mistaken for a dermatological issue, such as eczema or an allergic reaction. However, when the itching is widespread, unrelieved by moisturizers or antihistamines, and paired with other systemic symptoms like abdominal pain or unexplained weight loss, it warrants urgent investigation. Blood tests to check liver function, along with imaging studies like an MRI or ultrasound, can help identify whether a tumor is causing these symptoms. 3. Itchy spots on the legs or arm. Skin changes on the extremities, particularly persistent itchy spots on the legs or arms, can be linked to certain blood cancers, such as leukemia or myelodysplastic syndromes. These conditions affect the bone marrow's ability to produce healthy blood cells, leading to symptoms like easy bruising, fatigue, and skin changes. In some cases, leukemia can cause small, itchy red spots known as petechiae, which result from bleeding under the skin. Elderly individuals may attribute such itching to dry skin, poor circulation, or even varicose veins, all of which are common with age. However, if the itching is localized to specific spots, worsens over time, or is accompanied by other symptoms like frequent infections or bone pain, it could indicate a more serious issue. A complete blood count, CBC test, is often the first step in diagnosing blood cancers, followed by a bone marrow biopsy if abnormalities are detected. 4. Generalized itching. Without a rash, one of the most insidious warning signs is generalized itching across the body without an identifiable rash or skin irritation. This type of pruritus is often associated with systemic cancers, particularly those affecting the blood or internal organs. For example, chronic lymphocytic leukemia, CLL, and multiple myeloma can cause widespread itching due to the release of inflammatory chemicals or the accumulation of abnormal proteins in the body. In the elderly, generalized itching can be particularly difficult to diagnose, because it may be attributed to age-related skin dryness, medication side effects, or even psychological factors like anxiety. However, when itching persists for weeks, disrupts sleep, or occurs alongside symptoms like fever, weight loss, or night sweats, it's critical to seek medical evaluation. Doctors may order blood tests, such as a comprehensive metabolic panel or serum protein electrophoresis, to investigate potential underlying malignancies. 5. Itchy scalp or hair. Loss in itchy scalp in the elderly is often dismissed as dandruff or psoriasis, but in rare cases it can be a sign of cutaneous T-cell lymphoma, CTCL, a type of skin cancer. CTCL begins in the T-cells of the immune system and often manifests as red, scaly, itchy patches on the skin, including the scalp. Over time, these patches may thicken into plaques or tumors, and hair loss may occur in affected areas. What makes CTCL particularly challenging to diagnose in the elderly is its slow progression and similarity to benign skin conditions. Persistent scalp itching that doesn't respond to over-the-counter treatments like medicated shampoos should prompt a dermatological evaluation. A skin biopsy is typically required to confirm a diagnosis of CTCL, and early detection can significantly improve treatment outcomes. 6. Itchy skin. Around the anus or genitals, itching in sensitive areas like the anus or genitals can be highly distressing and is often attributed to infections, hemorrhoids, or hygiene issues. However, persistent itching in these areas can be a warning sign of cancers such as anal cancer, vulvar cancer, or penile cancer. These cancers are relatively rare but are more common in older adults, particularly those with a history of smoking, HPV infection, or chronic skin conditions like lichen sclerosus. For elderly individuals, embarrassment or reluctance to discuss symptoms in these areas can delay diagnosis. Doctors emphasize that any persistent itching, especially when accompanied by changes in skin color, lumps, or bleeding, should be evaluated promptly. A physical examination, possibly followed by a biopsy or colonoscopy, can help identify whether cancer is the cause. Why itching matters. The cancer. Connection itching as a symptom of cancer is often caused by the body's immune response to malignant cells or the accumulation of toxic substances produced by tumors. For example, cancers like lymphoma and leukemia trigger the release of cytokines, inflammatory molecules that can irritate nerve endings in the skin, causing itching. Similarly, tumors in the liver or pancreas can disrupt bile flow, leading to the buildup of bile salts that irritate the skin. In the elderly, the risk of cancer increases with age, and the body's ability to repair damaged cells declines. This makes it even more critical to pay attention to seemingly minor symptoms like itching, especially when they persist or occur alongside other red flags like weight loss, fatigue, or night sweats. Early detection of cancer significantly improves treatment outcomes, as many cancers are more manageable in their early stages. When to seek medical attention. Not every itchy spot is a sign of cancer, and many cases of itching in the elderly are caused by benign conditions like dry skin, allergies, or medication side effects. However, certain characteristics of itching should raise concern. Persistence. Itching that lasts more than a few weeks or worsens over time. Localization. Itching confined to specific areas such as lymph nodes, scalp, or genitals. Systemic symptoms. Itching accompanied by weight loss, fever, night sweats, or fatigue. Resistance to treatment. Itching that doesn't respond to moisturizers, antihistamines, or other remedies. If any of these apply, elderly individuals or their caregivers should consult a healthcare provider promptly. A thorough medical history, physical examination, and diagnostic tests like blood work, imaging, or biopsies can help determine the cause of the itching and whether cancer is a concern. Preventive measures and self-care. While not all cancers are preventable, elderly individuals can take steps to reduce their risk and maintain healthy skin. Stay hydrated. Drinking plenty of water helps keep skin moisturized and reduces dryness-related itching. Use gentle skincare products. Avoid harsh soaps or fragranced lotions that can irritate sensitive skin. Monitor skin changes. Regularly check for new or changing spots, moles, or patches on the skin. Maintain a healthy lifestyle. A balanced diet, regular exercise, and avoiding smoking can lower cancer risk. Regular checkups. Routine medical screenings can catch potential issues before they become serious. Conclusion. Itching may seem like a minor complaint, but for elderly individuals, it can be a critical clue to serious illnesses like cancer. By recognizing the 6 itchy warning signs outlined above, persistent itching in lymph node areas, chest or abdomen, legs or arms, generalized itching, scalp and genital or anal areas, individuals and their caregivers can take proactive steps toward early diagnosis and treatment. Doctors urge vigilance, as early detection can make all the difference in managing cancer effectively. If you or a loved one experience persistent or unusual itching, don't dismiss it. Seek medical advice to uncover the cause and ensure peace of mind. Thanks for watching and subscribe our YouTube channel.